Imagine on your next clinical shift, you're called to evaluate a patient with a history of asthma. She's in severe respiratory distress. Since you recently had good success with using NIV in a patient with COPD, you consider using non-invasive ventilation in this patient with asthma. But as you do that, you're wondering, can I successfully apply non-invasive ventilation to patients with asthma? You think you can because asthma has a lot of similarities to COPD. You've got airway obstruction, particularly during expiration, as a hallmark of both. And while the obstruction is somewhat different in its pathology, you're wondering if the clinical benefit with non-invasive ventilation would work on both. In asthma, you've got inflammation due to an accumulation of mucus and thickening of the bronchial walls. In COPD, you have the loss of elasticity of the walls. So you wouldn't be far off by thinking that non-invasive ventilation should provide similarly beneficial results. However, there's a dearth of literature on the use of non-invasive ventilation in acute exacerbations of asthma. A 2011 clinical practice guideline from the Canadian Critical Care Trials Group makes no recommendation about the use of non-invasive positive pressure ventilation in patients who have an exacerbation of asthma because of insufficient evidence. In fact, no studies have demonstrated improved morbidity or mortality rates from the use of non-invasive ventilation in patients with asthma. For these same reasons, a 2012 Cochrane review on non-invasive ventilation for acute asthma exacerbations states that this course of treatment remains controversial. No large randomized trial has evaluated the use of CPAP in asthma patients. In the literature that exists, the small trials looking at CPAP in asthma concluded that there was no harm to its use, but no conclusive mortality benefit or intubation benefit. The physiologic benefits of improved airflow and improved deposition of nebulized bronchodilators have not translated into a measurable change in clinical outcomes. In the absence of demonstrated harm, the clinical benefits of improved gas exchange, decrease in respiratory muscle work, and possible improvements in aerosolized bronchodilator delivery may justify a trial of non-invasive ventilation in patients with asthma. So despite the lack of support from guidelines in the medical literature, there really is no demonstrable harm with the trial of non-invasive ventilation in patients with acute exacerbations of asthma. Hopefully, I've convinced you to consider a trial of NIV for your next patient with an acute exacerbation of asthma.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.